There's good news and bad news for parts of regional New South Wales today. Stay-at-home orders in 12 areas have been lifted, but 2 other LGAs are tonight back in lockdown. Lismore and Albury have had tougher restrictions reimposed after local COVID cases emerged. Across the state, there were 1,351 new cases. Another 12 Sydney-siders have died, 6 women and 6 men. Leah White has more on today's developments in regional New South Wales.
Barely out of lockdown, Lismore businesses have been plunged straight back in.
We're fully stocked with a full cool room of fresh produce, which we don't know what we're going to do with now, to be honest with you.
Lismore has 1 confirmed case and Albury 2, sparking snap lockdowns in both areas.
Health has determined that 7 days will be appropriate, but I'm just warning the community that it may be longer.
A confirmed case attended a public school in the Lismore area on Monday. Several shops have been listed as casual contact sites. Health authorities say the infection was acquired in Sydney.
A parent that returned back to Lismore with their child, it was an exposure in the school environment as well, so that there is issues there.
At the opposite end of the state, one of the Albury cases is isolating in provided accommodation. The other is a man transferred from Mildura in northwest Victoria.
He's in ICU, he's been cared for. I understand he's not on a ventilator at the moment.
Among the exposure sites is a train that left Sydney on Sunday. Local businesses were still getting used to being open again after coming out of the statewide lockdown.
We offer a lot of personal styling in our shop and that real conversation face-to-face. So that's something we really rely on as a business.
I guess it was inevitable that it would happen, but very disappointing. Let's hope it's only for a week.
There was some good news though, with 12 local government areas, including the Bega Valley, Snowy Monero, Singleton and Narrabri, all coming out of lockdown.
Super excited, but also super nervous because I thought we would have had a day or two to prepare, not be open straight away.
But back in Lismore, employers like Steve Krieg are having to tell their staff they won't be required.
It really takes a lot out of you emotionally.
Just another day on the pandemic's regional roller coaster ride. Leah White, ABC News, Lismore.
And Leah White is still with us in Lismore. Leah, what does this mean for the border bubble with Queensland?
Juanita, Queensland has removed the Lismore local government area from the border bubble. Anyone who has been in the Lismore area in the past 14 days cannot enter Queensland except for a few set of circumstances like essential medical reasons. Those who are already in Queensland but have been in Lismore in the past 14 days need to get tested and isolate until they receive a negative result. Those in the border communities will be hoping these harsher restrictions don't extend to more communities.
Leah White reporting there. Well, this wave began 3 months ago in Sydney's eastern suburbs. Since July 16, more than 42,000 people across New South Wales have been infected and 210 have died. While much of the focus has been on Sydney's west and southwest, authorities are once again worried about areas closer to the city centre. Of particular concern is an outbreak at these apartment blocks in Redfern. 12 residents have already tested positive. Hundreds more live in the buildings and many of them are vulnerable.
The race is on to slow the spread. Testing and vaccination clinics have been set up at the front door.
The people here are concerned about COVID in the community, just like elsewhere.
At least a dozen residents have tested positive. Neighbours found out a fortnight ago, but since then the clusters kept growing.
They won't tell us. They said they have the right to privacy.
You're hoping that everything's going to be okay.
That was the big thing going on in our building. How did it get inside?
Quillatonga Rambuka is worried because some people are still allowed to come and go.
I hope everything is going to be okay.
Indigenous community leader Shane Phillips believes authorities should have pushed harder for locals to get vaccinated.
We needed the whole medical fraternity to switch this on probably 18 months ago.
These apartment blocks are home to many elderly tenants and other people who are vulnerable. Controlling the outbreak is critical to stop more people getting sick with COVID. Across the City of Sydney Council, there are 68 new cases. That's more than Burwood, Strathfield, Georges River, Bayside, Parramatta, Campbelltown and Fairfield. They're all classified as hotspots, but the inner city isn't.
It's not just the absolute numbers, it's whether or not the numbers are actually, or the people, not numbers, the people are moving around.
People in the councils of concern now have more freedom to move around for essential reasons at all hours. Last night, the first curfew-free in more than 3 weeks.
I'm actually very happy about it, to be honest with you. Now my partner can visit me without rushing home.
Really excited.
More than 1,200 COVID patients are being treated in hospital. That number has fallen slightly for the second day in a row. 231 people require intensive care. That's also down on yesterday, but 3.5 times as many as a month ago.
Yes, the system's under stress, but every patient is being moved into a location where they can get to absolute world-class health service.
Officials are again pleading with people not to do themselves a disservice by avoiding the jab. Rani Hayman, ABC News, Sydney.